Town Hall. Today, we are going to be discussing AARP's work at the Minnesota State Capitol from this legislative session and all the measures affecting caregivers, your money, your financial security, high cost of prescription drugs, and much more. As a nonprofit, nonpartisan organization, we are a social mission organization. We are in your corner fighting on issues that matter the most to you and your family. So joining me today is my AARP colleague, Mary Jo George, our Associate State Director of Advocacy, and she's here to provide an overview of the many things that happened at the Minnesota State Capitol this year. And equally important, we want to hear from all of you. This is an interactive call, and you can press *3 on your telephone keypad at any time to ask a question. And this is your chance to get information about all the activities that AARP Minnesota worked on at the Capitol this year and get your questions answered. So Mary Jo, thanks for being with me today.
Oh, I'm so glad to be here.
So give us just a quick overview of some of the priorities that we were really focusing on. And before you do that, just a reminder, for those of you joining us on the call today, this is an interactive call. We want to take your calls and questions. So press *3 on your telephone keypad at any time to ask a question. And for those of you watching online, put your comments in the comment section below or put your question in the comment section below, and we'll get to those as soon as we can as well. So back to those priorities, Mary Jo.
Well, Kathy, it was a really successful legislative year. As many of our members may recall, last year the legislature did not finish their work. And so there was a lot of catch-up work that we had to do. But we had a lot of wins. For example, we had a historic win for family caregivers with the passage of the Paid Family Medical Leave Act, which will be a really important bill for our law for family caregivers to take time off to care for their loved ones or for themselves. We passed 2 laws that will help lower prescription drug costs for seniors and all Minnesotans. We were able to make significant investments in home and community-based services to help seniors age in place. And then we provided tax relief, Social Security tax relief. It wasn't as much as we wanted, but it's a good step forward, and so we're really happy about that. But there's also tax relief for property tax relief for homeowners and renters alike. So we're proud of that. And then we passed a bill that we had been working on to really create a new generation of savers, and that's called Secure Choice for many workers who do not have access to a retirement plan. So all in all, it was a lot of work, but a lot of fun, and we're happy to talk about all these issues today.
A very big year, really important issues for older Minnesotans.
Yes.
And we're grateful for your work, and we're grateful for everyone on the line today, because this is your opportunity to hear more about all of those issues, ask about the details when those laws go into effect, and how they might impact you. And so we're grateful for you today. Reminder, this is an interactive call, and so if you want to ask a question at any time, please press *3 on your telephone keypad. You'll get into the queue. AARP staff member will ask your name and get a synopsis of your question. Then we'll put you back into the queue so you can keep listening to the call and get some more answers, and we will get to you as soon as we can, and you will be online with myself and Mary Jo today. And again, if you are watching online, put those questions in the comments below. We'll be taking your questions from online as well. So do you have a question about what's being done to protect your retirement income or to help family caregivers? This is your chance. Hit *3 on your telephone keypad, and you will be put into the queue, and you will have an opportunity to ask those questions. So we're going to share several important resources throughout the call too. So you might want to grab a notebook and a pen to write down important phone numbers, or just to keep track of some of that information. And we have a lot to cover today. As Mary Jo said, we got a lot done at the Capitol this year, and so let's get started. Mary Jo, we have a very dedicated team of volunteers that worked alongside you at the Capitol this session, advocating for a number of issues that were really important to seniors and their caregivers. So as we're waiting for some of those questions to come in, we know that some of those issues that you worked on are really going to help Minnesotans in retirement. Can you talk just a little bit more about those efforts?
Sure. I think, the big issue that we worked on was to lower the taxes on Social Security benefits. We know this is a really important issue to our members, and we had all along said that this is a program that's very important to seniors, and that really it wasn't a way to fund state government. So we had gone in the session with a total elimination of social taxes on Social Security benefits, but we weren't able to get the full enchilada. But I do think what lawmakers did will make a significant step to those seniors who are struggling. So what it does is it eliminates taxes on any married couple earning up to $100,000 a year and up to $78,000 for a single tax filer. But then there's partial relief, and so anybody for a married couple earning up to $140,000 a year, they will get some partial relief. And for a single filer, that's up to $118,000. So we think that was a really good step, and we're really glad. We think this is a much better approach than how our law was in the past, where we had this complicated subtraction formula that a lot of taxpayers didn't know if they were paying taxes on Social Security or not. So we're happy about that. Also, I think some of the property tax relief is going to be really important for seniors. And as I said earlier, it's for homeowners and renters alike. So there is both one-time and ongoing tax relief for what we call the homestead credit. So people who are homeowners can take advantage of that. So what we did was we raised the income threshold, so more people will be eligible for that. The other thing, which is really a historic change, is we made significant changes to the renter's credit. Today, people, when they file for renter's credit, have to do it separately from their income tax. So they do it in the fall of the year. Mm-hmm. And what we find is many people end up not even applying for it. And so there was estimated about 20,000 people who were already eligible, but just didn't file for the benefit. So this year we're going to change it, and you're going to file at the same time as your income tax.
And will that take effect when folks file their
Yep.
2022 taxes in 2023?
Yes. So it's going to be a big improvement. So they'll get their benefit. They also, change the definition of what we call household income, which is simpler and also will bring in more people. So we're really happy about that. I think there was some other property taxes that some of our members might be interested in, what we call the senior deferral property tax program. This is if you have a lot of equity in your house, but you're cash strapped. This allows you to defer your property taxes. So we changed the qualifications for that program, higher income, and that you didn't have to be in your home it was 15 years. We've lowered it to 5 years. And then there's a targeted relief proposal. So we've seen many people struggle because property taxes have risen very fast. Mm-hmm. And so there's a targeted relief, which if you do see a spike in your property tax of 6% or more, you will be eligible for a larger refund. And then last but not least, for those who haven't retired, as I talked about, we created this new program called Secure Choice, which is really going to help a new generation of savers save for their retirement. I think one of the things we know is many workers do not have access to a retirement plan, and that can be very problematic to save on your own. So this requires employers to automatically enroll workers into this Secure Choice plan. It's voluntary for the worker, but we think it's going to really help create some retirement security for a new generation. That's really important.
Yeah, so that's great to have the option. And do we have any information on how, are people more likely to save if they have that option through work?
Oh, absolutely. If you have access to an automatic enrollment plan, you're more likely to save, 20 times more likely to save.
Wow, that's impressive.
Yeah.
And we know that it's, folks, Social Security was never intended to be the only source of income in retirement. And so to have that extra opportunity to save is just critical to financial security in the future.
I think it's going to be a big win for people who want to retire and want to retire with dignity.
Great. Well, we want to hear from you. All you have to do is press *3 on your telephone keypad. We will get you into the queue and take your questions on all of the things Mary Jo just talked about, as well as the rest of the work that we worked on this session. We do want to take those questions, and I would like to bring in my colleague, Erin Parrish, to help facilitate some of those calls. Erin?
Hi, Kathy. Our first caller is Otto, who's from Breezy Point, and he has a follow-up question about the Social Security tax issue that Mary Jo mentioned. Otto, go ahead with your question.
Thanks for taking my call. My question was basically, I think the statement was made that they took a big first step on taxing Social Security income in the legislature this year. And I've been following this relatively religiously, and I think this is like the third or fourth session where the question of taxing Social Security income came up. When the Republicans had the majority, it didn't seem to make it. And now that the Democrats have the majority, it didn't seem to make it. Yeah, I believe they raised the income threshold, not sure exactly what it was, but I'm wondering why they tax it at all. It's kind of like double taxation, is it not?
Yeah, Otto, thank you for your question. And Minnesota is one of, I believe, just 12 states that still taxes Social Security income benefits. We know it's taxed at the federal level, and at the federal level, that those taxes go back into the Social Security Trust Fund. Mary Jo, can you address Otto's question and what changes we did make? I know it was a big step forward.
Yeah, Otto, this is one of these issues where it really is, it does fall down on party lines. I think we see that, the Republicans have been very strong about wanting to eliminate the tax altogether. But I think with the Democrats, what you see is that they're very concerned about the cost. So if you look at, if we eliminated the tax altogether, it would cost about 1.5 billion every biennium. And so they were concerned about that. And even though, the legislature had a $17.6 billion surplus, so much of that was one-time funds. But we did see a bunch of Democrats come out and advocate for total elimination this year. And so we really were, helpful to them and really pushed a lot. But I just think in some of the Democratic progressive circles, they just have, a real concern about what the elimination would do. And in fact, there was a lot of organizing against this tax relief by seniors. So that came out of really nowhere this year. I think we just saw a lot of seniors worried about what that would do for their services for their grandchildren or their children. And so many of them had urged lawmakers to take a balanced approach. But on the issue of double taxation, actually, it's not really double taxation because workers are paying in half of the contribution and the employer pays in the other half. And so if you look at an actuarial analysis of what benefits you receive versus what you have put in, there really is, people are getting more benefits out than that they put in. And so I was chewed out one time when I told the Senate tax chair about double taxation, and she was like, there is no double taxation. But I just think this is a issue that we're going to have to keep fighting, but I think it's one of these issues right now with the Democrats in control that we will probably just get this balanced approach. So hopefully you'll get some relief, Otto, but I know we'll continue to fight for more.
Yeah, and I know we've been working on this issue a long time and making some incremental progress along the way, but this at least we got some relief. And I believe about 76% of Minnesota seniors will see some sort of relief.
That's right. It's the relief is going to go to about 76% of seniors. So it was just the higher income individuals that will not be benefiting from this tax relief.
And we know this is an issue that everyone cares about because we hear about it all the time. So appreciate that question, Otto. Just a reminder, you can press *3 on your telephone keypad at any time, and you can ask your questions about the work that happened at the Minnesota State Capitol this year on behalf of Minnesota's seniors. And if you're watching online, we know we have a lot of folks watching on Facebook. Add your question to the comments, and we will get to those questions as well. Speaking of questions, Erin, do we have another caller with us this morning?
We do. Next, we have Bernetta, who is in Buffalo, who has some follow-up questions about the property tax relief Mary Jo discussed. Bernetta, go ahead with your question.
Okay. Thank you for taking my call. I just have a question. If there's any chance of them freezing property taxes for people that are over 80. It's just, they're like taxing us off. We live close to town, and they're taxing us practically off the farm, and it's difficult these days because the taxes just keep going up.
Yeah, thank you for that question. Our research and our information tells us that people want to stay in their homes and communities as they age, and sometimes property tax becomes a real barrier to that. Can you address the question, Mary Jo?
Yeah, it's one of these things where even our own policy at AARP policy, we tend to base it on income, not necessarily age. And so most of the home owner credit that we have been supporting is really targeted to income and not age. But I hope that you could take advantage of some of the programs that we did pass this year. And so it would be good if you could talk to your county to see if you are eligible for any of these programs, because there's a homestead exclusion that I didn't talk about either that increases the value of how much you can exclude from your property taxes. The homestead credit, I think that was a very important one. The targeted relief, if you're seeing a spike in your property taxes, originally it was if you had a 12% increase. We've lowered that now to 6%. So hopefully there are some programs that you could make yourself available to, but we haven't quite gone down the road on age as a factor in reducing taxes.
And how about the property tax deferral that you mentioned? Is that something that might help someone in their situation?
Yeah, that could. The senior deferral program, what that does is if you really find you have a lot of equity in your farm or your home and you're having a hard time meeting the costs of your property taxes, you can defer them off until when you are passed on and you sell your home. And then the county will pay for your taxes out of the proceeds of your home. So that is a good way if you feel like you're not being able to meet the day-to-day costs, because we know long-term care costs are expensive, prescription drugs, and with inflation, people have been paying higher utility costs and food costs. So yeah, that's another one that I would really encourage you to contact your county to see if you might be available or if any of these programs are available to you.
And the county is the best place to reach out to for that, or
Yeah.
are there other places that folks should look for assistance?
Well, I think the county is the best place because they administer the programs. The state, develops the program, but the counties are the ones that you can reach out to find out about them.
Okay.
And a lot of people don't know about them,
Right.
and so I think I was just telling my family members about the senior deferral program, and they got a few of them excited because they're wondering as they age, will they be able to stay in their home?
Mm-hmm. Big concern
Big
for sure.
concern, yeah.
Erin, let's take one more question, and then we have a poll. So get ready to use your telephone keypad to give us some feedback. We do want to hear from you, but let's take one more question before we go to that poll.
Our next question is from Bill, who's in Minnetonka, who has a question about home care. Bill, are you on the line?
Yes.
Go
Thank
ahead
you.
with your question.
Yeah, thank you for being there. The cost of home health care for seniors is going up at a ridiculously high price. Did you try to do anything at this session for assistance for seniors in staying in their own home?
Yeah, thank you, Bill. That is a great question, and we know lots of folks, have similar concerns. We know that home and community-based services go a long way to helping people age in place. So, Mary Jo, can you share more?
Bill, we did. We have been advocating for the last several years to really make significant investments in the home care program. So Minnesota does have a lot of different home care programs. Some of them you have to qualify for medical assistance, which can bring your income down very low in order to qualify. So we have the elderly waiver program, the alternative care program. We have the essential community support program. But these you have to really meet the threshold of medical assistance. But sometimes those income levels are higher if you're, for example, married with a spouse, because they allow the spouse to keep more of the income. But we also passed a program called the Live Well at Home program. Now, this is a program, I don't know what county you're in, Bill, but
It's Minnetonka.
Minnetonka,
Yeah.
there should be a program out there. This is a program that we were able to get more funding for and an extension of the grants. There's providers that receive grants from the state to provide that assistance for seniors in their homes, and it's on a sliding fee scale. And so, if you're over the threshold of Medicaid, you might be eligible for some of those services at a discounted rate. And they also use a cadre of volunteers. So one of the big problems that we've been having is that, there's just been a dire workforce shortage, and there haven't been people out there to find to take care of folks. So they've been using a lot of volunteers to help with your chore services, transportation, do some grocery shopping. So I would really encourage you to maybe we could have Bill call the senior linkage line. If
I was just going to say, we
Yeah.
can share a few resources.
I think that would be
Yep.
great, just to see if he's maybe doesn't know what's all available to him.
Yes, so the senior linkage line is available to anyone. It is the Minnesota Board on Aging's free statewide information assistance service. Experts can provide links to services for older adults, excuse me, as well as their caregivers, including home care efforts, and respite care or adult daycare and more. So if you happen to have a pen or pencil handy, I'll give you that number now. It is 800-333-2433. Again, that is the senior linkage line, 800-333-2433. And that is a great place to start if you are looking for some of those home care services or how to take advantage of some of those programs that might be available to you to help you stay in your home. So thank you for that. I do want to remind folks that you are participating in an AARP Minnesota telephone town hall, recapping the work that was done at the Minnesota State Capitol this year, the legislative session that just ended, and all of the issues that we worked on to make things better for people 50 and older and their families across the state of Minnesota. This is an opportunity for you to ask questions about how some of these measures might impact you. So please press star three on your telephone keypad at any time, and we will get you into the queue to ask some of those questions about how you might be impacted by the work that happened this session. And for the folks who are watching online, put your questions in the comments, and we will get to as many of those as we can get to during our time together as well. All right, we want to hear from you. This is a time for you to share some information with us. We have lots of great questions in the queue. We'll get to those shortly, but I want to ask you a question, and you can use your telephone keypad to participate. So we know that our volunteers and our members came out in droves. We had more than 11,000 emails, phone calls, in-person visits, letters that were sent, cards that were sent to lawmakers on behalf of seniors in Minnesota on the issues that we were working on. And we'd like to know how you participated in the session. So during the 2023 legislative session, please press 1 if yes, you contacted your elected official about an issue that we're discussing on today's call. So if you made a phone call, if you sent an email, if you contacted your lawmaker about these really important issues, please press 1. If you did not contact your elected official, please press 2. And please press 3 if you contacted your elected official about an issue that we're not discussing on this call. So if you didn't talk about, or if you called your lawmaker, but it wasn't about one of these issues, that's number 3. So your responses again. Did you contact your elected official this legislative session about any of the issues we've discussed today? Press 1 for yes, you contacted your elected official about an issue on today's call. 2, if you did not contact your elected official about issues discussed on today's call. And number 3, if you contacted your elected official, but it was about a different issue. And we will announce the results of that poll shortly. We see some of those answers coming in. So we appreciate that, and we'll share the results in just a few minutes. In the meantime, let's get back to some of those questions. Erin, who do we have on the line?
Our next call comes from Michael in Eden Prairie, who also has a question about home care. Michael, go ahead with your question.
Yeah, my question is, and it involves private duty home care. And what I'm wondering is, there are hundreds of companies out there that do private duty home care. Is there any kind of a rating system that anybody keeps, whether it's the county or the state or Medicare or whatever, in terms of the quality of the services that are being offered by these many companies? I mean, I've got probably at least 100 that I'm looking at right now. And how do you know which are the ones that are highly rated? For example, I just found out that there's a rating system for transitional care units. It goes from 1 to 5. I didn't know that, and I've been in a couple of them. But I was wondering, for private duty home care, is there some kind of a ranking system that I could go to, or anybody could go to look and see how all of these companies are rated?
Yeah, Michael, that is a very great question, and you are a wise, wise man to do your homework. I always think a great place to start is talk with your friends and your relatives, and if someone knows of anyone that they can make a recommendation. I think also the senior linkage line might be able to help you kind of hone in on what specific services you might need, which can kind of help. So doing your homework is a great first start. But Mary Jo, is there any other resources for Michael?
No, that is a great question, Michael. And I was just thinking, one of the things that we're doing right now is I'm in a task force that we're helping. Well, it's been going on for 2 years, but we're creating a report card on assisted living facilities that we can measure them with certain different measures. But I don't believe there is one, but I do think it is helpful, as Kathy said, is to talk to folks. Maybe set yourself up some interview questions that you can ask them. I would talk about, how well is your staff retention? Are people staying with the company for a long time? What's their experience? Do you have somebody I could talk to that you have provided home care? Some referral that you might be able to talk to them. But I can imagine that it is overwhelming. But I think some of them, I think the senior linkage might be able to say some in your area, or as you talk to maybe in your clinic, maybe your doctor might have an idea on that. But it's a really important question and an important need. And
It is.
I'll see. I took your number down because I actually thought it was such an interesting question, and I'll see what I can find out from the Department of Health officials if they know anything on that. So
Yeah,
we'll get
and-
back to you if we have.
Yeah, and when it
any.
comes to long-term care facilities, AARP does have a nursing home scorecard that we issue, but it is just so important to do your homework, talk with your family members, someone who might be helping with your care to help have a second set of eyes and ears when you do some of those interviews and talk with folks to make sure that they can address your needs. So thank you for that question. All right, let's get to your responses. So we wanted to know how many of you on the call today contacted your lawmakers about the issues that we were talking about today. And we had, close to 20% of those who are joining us on the call today did call your lawmaker and or send them an email or a letter about the issues that we're talking about today. About 62% of you did not contact your lawmaker, and about just over 20% contacted your lawmaker, but about different issues that we were working on. And Mary Jo, I know you will attest to this, that our volunteers and the folks who make their voices heard are so powerful when it comes to making progress on some of these issues that, it's one thing for Mary Jo and myself to talk to lawmakers, but they want to hear from you. They want to hear from the
Yes.
people that are directly impacted. And so if you weren't one of those folks who contacted your lawmaker this year, we encourage you to get involved in the future. And it's pretty simple to send a quick email or make a quick phone call. It's not intimidating because these people were elected to represent you, and they want to hear from you about what matters most. And so your voice is so very powerful in this process.
Yeah, and I would just like to add that, really a bill comes from an idea. So lawmakers are very interested in hearing from their constituents. And, we've had people, approach lawmakers on their ideas and they have become laws. So don't be intimidated. I think some people might feel like they have to, know everything they're talking about, but no, you don't. And if you want to join our team, we provide a lot of training, but it is, as you said, so important that lawmakers hear from real people. And that they represent you, and that is their job. So
And
we
again,
really
that's one of the
encourage that.
reasons we were able to get so much done this session, is because lawmakers heard from you. They heard from our members, they heard from AARP members across the state on what was important to them. So just a reminder, if you are just joining the call, if we have new folks coming in, I'm Kathy McClear, the State Director for AARP Minnesota, and you are participating in a live telephone town hall talking about the issues that we got across the finish line at the State House this year. And I'm here with Mary Jo George, our Associate State Director for Advocacy, who was pounding the granite floors, shoe leather lobbying, on your behalf. And kudos to Mary Jo and for the work that you got done. Certainly, you don't do it alone. You do it with a team of volunteers. You do it with a team, a coalition of folks who were working on the same issue, and so important. But we want to hear from you. Press *3 on your telephone keypad at any time during this call. We're going to get you into the queue, and we want to get to your questions. Speaking of that, I think we probably have a few more folks who have some questions. So, Erin, let's go to our next caller.
Yeah, Kathy, we're going to take our next question from someone who is watching online, and that's from Carla, who's in Roseville, and she has a question about who can use the paid family medical leave program and who can you use it to care for?
Oh, that is a great question. So we talked at the beginning of the call about the paid family and medical leave plan program that is now law and will go into effect. That's going to have a tremendous impact on caregivers.
Yes.
And we know we have 530,000 unpaid family caregivers in the state of Minnesota who provide $10 billion in uncompensated care on an annual basis. This program is going to help them so very much. Let's talk more about that paid family leave program.
Yeah, it's going to really help change the long-term care support and services so that people can have their family caregivers take time off. But in terms of the definition of family, it is very broad. So a worker can take time off for their own serious medical condition or take time off for a family member, and also take time off for somebody that they have an expectation that they have to provide care for. So, for example, that could be your friend or your neighbor or your roommate, or you have a significant relationship. So it goes beyond the relationship of having to be married or be related by blood. So we really fought hard for this because originally in the bill it was very limited. In fact, lawmakers in the Senate had limited it to just one family caregiver could use the benefit. And we said absolutely not. If everybody is contributing, everybody should benefit, and families want to be there for each other. And so if your mother is dying or your father is really ill, everybody in that family should be able to take time off. But somebody, if there is, a significant relationship and there is an expectation of care, we know many seniors are solo right now and they don't have any family members, but they might have a lifetime partner that they're not married to. Those folks will also be able to take advantage of the program.
That's incredible. Can you talk a little bit more about how much leave can someone take and some of those specifics?
Yeah, the bill is, it allows for 12 weeks of family leave and 12 weeks for medical leave, up to a maximum of 20 weeks a year. So that's very generous. I think that will give people a lot of peace of mind in being able to really take the time. Because yourself as a caregiver, you can just really scramble and try to have to balance that work with that caregiving. That can be extremely stressful.
Yeah.
So that this will give people at least a modicum of some financial security, and we think it will help reduce the emotional and physical stress as well. And then one of the unique things about our bill is we have a progressive wage replacement. So what happens is that if you are low income, you can get up to 90% of your income replaced. what we found in other states that had passed the legislation is that low-income workers weren't able to take time off because they couldn't live on 50% of their salary. So that's a very equitable part of our bill. And so we think that's going to really help for everybody to be able to take advantage of the program. And then the other benefits to the program is there is some premium support for small businesses. We think that's really important. There's also a grant program if small businesses have to hire a temporary worker, for example. So it's a really good bill, and we're really excited about it.
And Minnesota is kind of a leader in this. I mean, we're one of just a handful of states
Yes.
that have a paid leave program now.
Well, we're the 12th state to pass it, but we're the first Midwest state. So what we like to say is, watch out, our border states, because people might just be moving here to have babies and to take care of their loved ones. So
Yep.
we're excited.
Great opportunity to help people take care of those that they love.
Yep.
And it is a challenge, you're right. When you have to choose between a paycheck and taking care of a loved one,
Yeah,
that is a heartbreaking choice to make.
yeah, we shouldn't have to make that, right?
And you've been working on this for a very long time.
time.
This has been a long time in the making, more than 10 years, I believe.
Yeah, it's been more than 10 years. So it just got better with time, I guess. We had the opportunity to really hone in on the policy and learn from the other states that had gone before us of what worked and what didn't. So we think we have at least maybe not the best bill, but one of the most equitable bills in the country.
Well, thank you for your work on that. Erin, do we have another question?
We are going to go to another online question from Betty in Detroit Lakes, who's really concerned about the rising cost of prescription drugs, and she's curious if the legislature did anything to address that issue.
Yeah, Betty, that is a great question. We know that, just as folks are making difficult choices to choose between their paycheck and caring for a loved one, they are making choices between covering their basic needs and making sure that they have that critical life-saving or life-improving medication. So what did we do in regard to prescription drug prices this session?
Well, this session at the state level, we passed 2 laws that will help lower prescription drug costs. One is we give the Attorney General more tools to go after pharmaceutical companies that price gouge. So it gives him some legal remedies to if a company increases their prices in an unconscionable way. I think many of our members might remember Martin Shkreli, who bought Turing Pharmaceutical and overnight took one of the prescriptions that was $13 a pill and increased it to $750 just overnight. So nothing is stopping pharmaceutical companies from increasing and price gouging. So the Attorney General will be equipped with more tools to be able to go after those bad predators. Then the other issue we passed was the Prescription Drug Affordability Board. This board will be looking at the cost of different drugs and those that pose an affordability challenge. There's different thresholds in the bill, and they will be able to set what we call an upper payment limit. And that upper payment limit will go throughout the healthcare system. So all stakeholders will benefit from that, including consumers. So we're excited about that. That board will be getting up and running next year in January. So we'll be making sure that we're advocating at the board, and consumers can, come to the board to talk about certain drugs that they have. And before we passed this bill, we had passed a transparency law, a prescription drug transparency law. And so the Department of Health is armed with a lot of data on what drugs have been increasing. But in addition to that, I think there's the federal reforms that we did that are so significant too for Medicare recipients. Because I think what the Prescription Drug Affordability Board will do is they can set these upper payment limits and then Medicare can follow them. But I think one of the things we know is with the historic Medicare price negotiations that we
the Inflation
passed,
Reduction Act.
the Inflation Reduction Act, and capping out the out-of-pocket costs will go a long way for Medicare recipients. And then there was one other thing that lawmakers did pass this year, and that was they do cap the co-pays to $25 for chronic conditions. And that's not only for drugs, but it's also for medical therapies. So that's another great thing. So we got a lot of good things, and the pharmaceuticals are really, like a monopoly. And so really this Prescription Drug Affordability Board is similar to like our Public Utilities Commission.
Yeah.
You need some way to regulate those prices.
Well, that's a great example of how AARP is fighting for you both at the federal level with the Inflation
Yes.
Reduction Act and securing negotiation on drug prices through Medicare, capping out-of-pocket costs on Medicare Part D, capping insulin,
Yep.
and what we're doing here at the state level. And
That's
so
right.
we're not just at the State House, we're also in Washington, D.C., working on your behalf, and in some cases, even on the local level.
Yes.
So, Betty, thank you for your question on prescription drugs. That was another a big issue that we hear about from our members on a pretty regular basis. Erin, let's go to another caller.
Sure. Our next question comes from Jan, who's in Blaine, and her question is taking us back to the Social Security tax conversation. Jan, are you still on the line?
Yes. Yeah, my question.
Go ahead with your question.
Well, my question concerns, first of all, it's unfortunate that we even have tax on our Social Security, but now the people that are just a little bit over the level, like over the 100 or 117,000, will not get any help with that. And what is happening is they're helping the people that are under, but it's the lower middle class and then there's an other middle class. We've all worked for these tax relief, and everyone should be affected by this change. And unfortunately, they just put it into that one level. So is there any help with the people that make over, say, 115,000 that are single?
Yeah, thank you for that question, Jan. And we hear from folks all the time, and that is why, we took the stance that we wanted full repeal, and we tried very hard. We fought for it, and we just couldn't get that full repeal. But Mary Jo, can you talk a little bit more about the specifics on Social Security?
It's unfortunate. What it does is it's a phase out of the tax relief, so it's partial relief, so that we didn't have a tax cliff. But I guess, as you're pointing out, there is a tax cliff at a certain point. So if you're single, you get, you'll pay no taxes up to 78,000, and then that other income that you're taxed, it'll be phased out up to 118,000. So you'll get some relief of the money, of your money up to 118,000, but you won't get the total elimination of your Social Security tax. So it would be interesting. It'd be interesting to kind of look at, we have actually a tool that we posted on our blog about, it's a calculator to look to see how much you would pay. Because one of the things they also did, which we had really encouraged them to do, they did change the standard by which how we measure your income, and they changed it to adjustable gross income, which is a better calculation, and so it will bring in more people. Adjusted gross income originally from the provisional income that we used to use. So yeah, we do have a calculator. So if you do have, it's possible, because it's so complicated, because they tax your other income along with your Social Security income, it's possible, depending on how much your Social Security is in your overall income, that you won't in fact be paying taxes on it. But again, it's a calculation of what other income. So if you have a pension and you have Social Security and you have investment income, you might be paying some of it on there. But I think you'll get some relief up to a certain point.
Yeah, and if you need to find that calculator, we do have it posted on our blog at aarp.org/MN Advocacy. And that's a great place to read more about the issues that we worked on as well. So speaking of our advocacy, I do want to take just a few minutes while we do still have time. And if you want to ask a question, please press *3 on your telephone keypad to get into the queue. And while we're waiting for a few more of those questions, I want to recognize the work of AARP Minnesota's advocacy team, our volunteer advocacy team. This dedicated group, they meet with lawmakers at the Capitol. They're there several times a week. Even when the hearings went late into the evening, they were there being the face and the voice of older Minnesotans. They wrote letters, they talked with community members about the issues that impact older Minnesotans and their families, and we could not do that work without them. And we invite you to join our advocacy team as well. The fact that you are on this call today and you care about these issues means that you are vested in the work that we do, and we would love to have you on this team. So if you are interested in learning more about our volunteer advocacy team, press 1 on your telephone keypad, and we will have someone get in touch with you to get your name and number and get some additional information. So again, press 1 if you want to be a part of this exciting work and join AARP's volunteer advocacy team. Now let's get back to a few more questions in the last few minutes of our call. Erin, who do we have next?
Our next call comes from Tom, who's in Orono, who has a question about low-income seniors. Tom, go ahead with your question.
Well, I'm a low-income senior. I'm in my 80s. I've been in my property for over 50 years. Now the taxation people are going ahead and they're increasing the taxes of everybody in this particular area. And they have, I have a house that's worth someplace around less than $20,000 according to them, but they're taxing me, going to be taxing me next year $760 some thousand dollars for the property tax. Well, I can't afford these increases because we're trying to live on Social Security and a little bit of our investment. We don't have much of that left. So the only thing that they have offered so far is that I can get a low interest loan to help me pay the taxes. Well, that means I'm going to end up paying even more money in taxes, property taxes. What can be done to separate me out from all these multi-million-dollar homes that are around me, so I don't have to leave my home because the taxes are too high?
Yeah, that's a great question, Tom. And possibly that property tax deferral might be a good option for Tom, but can you address that again?
Tom, I took down your number, and maybe we can talk a little bit more, because when you say they're asking you to take a loan, are you talking about the county assessors? Because what Kathy was talking about, I don't know if you missed it in the call, but earlier we talked about the senior deferral program, where you don't have to pay your taxes until your house is sold, when after you've passed on. And that has helped people like yourself, where you've got a lot of equity in your home, but you really don't have the cash. So I would really encourage you to look into that. And it would seem to me that if you're living on Social Security and little investment income, that you might be eligible for the homestead credit. There's going to be a one-time credit of 20% that people can qualify, and ongoing. That's based on the value of your house and your income. So you could talk to your county about that. But then there's also the other one that we talked about, if you're experiencing a property tax spike. So if your taxes went up more than 6% in the last year, you could qualify for a refund up to $2,500. It used to be capped at $1,000, and now it's $2,500. And in the past, you had to have a spike of 12% or more. So, Tom, I as I said, I took your number, and maybe I could call you after, and we could talk a little bit more about this. But I certainly hope in your situation that there would be some relief for you. And I appreciate those smaller homes out there, and that they don't replace them all with big McMansions. So we want you to be able to keep staying in your home and community, because that's so important.
Thanks, Mary Jo, for that. We do have a couple other online questions that came in. We know that groceries are getting so expensive, and I've read more and more seniors are relying on food shelves. What did the legislature do to address senior hunger?
Oh, well, that's a good one. They did some emergency funding right away for food shelves, and then they doubled back and came back and invested more on food shelves, because we are seeing a growing population of seniors having to rely on the food shelves. But the other thing that we worked on and advocated for was more funding for senior nutrition. And so that is, home delivered meals. And so there was an increase to that program as well. And so really, sometimes people are maybe afraid to ask for help, but we really encourage you to call the senior linkage line and find out if you're available. And last year, we had increased the SNAP benefits, the senior nutrition supplemental benefits. And so there are some benefits that are going to be available to folks, but sometimes people might be too proud to ask for help, but we really encourage you to do it because food costs are so high now.
They are. And if you need more information on whether you're eligible or where to find some of those resources, we really encourage folks to call the senior linkage line at 800-333-2433, and they can get you pointed in the right direction. You can also contact your local area agency on aging. So if you're not here in the metro and you're outstate and you need to know what services are available to you, you can contact your area agency on aging. 800-33 that is the same number, 800-333-2433. So that'll get you through to the senior linkage line wherever you live. So Mary Jo, I do have one more question, and then we will go to one final caller question in just a moment. But coming off of the COVID pandemic, we know it was such a challenge for our nursing homes, and we've been dealing with such a shortage of workforce and just challenges in meeting the needs of individuals who do live in nursing homes.
Yes.
What was done this session to address the shortage in long-term care facilities?
There was substantial increased funding to nursing homes as well. So there's about $300 million at the end of the session that went to nursing homes to ensure that they can hire staff and that we can have quality care in these facilities. They also did get a low interest loan, $100 million for a low interest loan that will help them bridge the gap, because under the way that we do pay nursing homes for their costs, but the system kind of is delayed, and it's about 18 months delay. So some facilities just need a little bridge, a little help to make it to the next payment round. So yeah, we're very pleased. It's very important that we have a continuum of care, that we pay not only for home and community based, but we know that we have to have high quality nursing homes. That's very important.
Yeah, thank you for that. So we will get to one more question, and our time has run so short because we had so many things to talk about today. So we do have time for one more question. If we didn't get to your question today, we apologize for that. We do want to hear from you, and you will have an opportunity to stay on the line after the call. Leave a voicemail with your name and phone number, and we can get back to you to answer those questions for you. So Erin, let's go to one last question.
Yes, our last question comes from Jim, who's in St. Paul. Jim, are you still on the line?
Yes.
Go ahead with your question.
Well, great job to the staff. And as has been said, we couldn't have done it without the volunteers. So it's been a historic session. What should we be doing now? Should we be thanking our legislators? Is there other work ahead of us?
That is a great question. And we will be mailing out information about all the measures that we've accomplished so that folks know about it. We're using all of our channels to make sure people are informed about these really important programs that will impact them and that they can take advantage of. But that's a critical piece, is saying thank you.
Absolutely. What a great question, Jim. I think that's absolutely right. As much as we give politicians a bad name, they do work long, long hours, and they really do listen to many of our, organizations and people, and they did a great job this year. So we would really encourage folks to say thank you. You might see them in the grocery store, say thank you, or we will be sending out something that you could sign your name to if you were inclined. That is a thank you note, but that is really important because we'll be back next year and we'll be wanting more. So it's important to thank them for their work, but know that they're on the hook to do more for us eventually too.
Yes. And these folks were elected to represent you and address the issues that matter to you. So when they do something you don't like, it's important to let them know.
Yeah.
But when they do something you do like,
Yeah.
it's equally important to let them know that you appreciate the work that they do and that they are representing you. That's what they're in office for.
That's right.
All right. Well, it has been a great hour talking about so many wonderful things. And on behalf of AARP Minnesota, I just want to thank everyone who listened today, who asked really good questions on our telephone town hall. And I especially want to thank Mary Jo George for sharing your thoughts, for the work that you did, along with the rest of the AARP Minnesota staff. For those of you who don't know, we have just 8 staff members in the Minnesota State Office. And so it takes a village, and we have a small but mighty team, and we rely so heavily on those volunteers. So for those of you who are volunteers, we thank you for the work that you have done. I also want to share that in the weeks and the months ahead, we will continue fighting for older Minnesotans at the state capitol and in Washington, D.C., including protecting Social Security. We know that this is such an important issue to the financial security of individuals in retirement. And we want you to be part of those efforts. And so if you are interested in learning more about advocating with AARP, again, stay on the line, leave us a voicemail, tell us you're interested in volunteering, and we will make sure we get someone in touch with you and get you some additional information. Make sure you leave your phone number so we know how to get in touch with you. But we want you to be part of that work in our efforts to protect Social Security for current and future generations. So again, thank you for participating in this really important discussion. Again, if we couldn't get to your question, we apologize for that. Time just goes so fast and we had so much information to cover. But again, stay on the line, leave us a voicemail with your name and your phone number, and we will get back in touch with you. If you want to become a volunteer, stay on the line and leave us a message on that as well. So again, thank you for your participation today. And I also want to let you know that you can get additional information through AARP publications, our AARP the magazine, the bulletin that we mail to all of our members, or on our website at aarp.org/MN, or you can call 1-866-554-5381. And again, that number is 1-866-554-5381. So again, thank you for your participation today. Thank you for making your voice heard, and have a great afternoon.